Guys, do you know that if a person becomes older, then a person would likely to get many kinds of problems which are basically related to our bones. Some kinds of problem is that people will get difficulty while standing and while sitting and also while doing any work. Okay, so these are the problems which are basically related mostly with the bones. And today in this video we are going to discuss about one such kind of bone problem that is known as osteoporosis, and this osteoporosis is very common worldwide. So what is osteoporosis? What are the causes, symptoms and treatment? These things we will discuss in this video. So hi, my name is Satarva and welcome back to my channel. So guys, what is osteoporosis? Basically this osteoporosis is a kind of a condition in which the bone density becomes lower, and if the bone density becomes lower, then the bones become weak, and if the bones become weak, then there is more chance for the bones to be fractured. So this is called as osteoporosis. So what are the causes basically for this osteoporosis? So basically the causes for this osteoporosis is because of lack of calcium and vitamin D. And as you know that calcium and vitamin D is very good for the bones to make the bones stronger. So if you don't take these kinds of nutrients, and if there is lack of these two kinds of nutrients, then the bone can become weak. So this is the one cause for this osteoporosis. And second cause is because of some hormones. So if the women becomes older, then their estrogen level will become less, and if the estrogen level will become less, then there is more chance for getting osteoporosis for older women. And even for older men also there is same kind of problem. In the older men, if the estrogen level will become less, then for this also the osteoporosis chance is more. So that's it, there is some because of this hormone changes. And third thing, because of taking some kinds of medications. So if a person is taking steroid drugs or the steroid medication, then also the person is likely to get this osteoporosis. So these are some of the causes for this osteoporosis. So what happens inside a person bone when a person is getting this osteoporosis? So for that we need to take this cross section of the bone. So you may be thinking that this bone is harder. Yes, it is a harder. This bone is the hardest substance in the body. But actually you will be shocked that the bone is hard outside, but it is very soft inside. Inside it is very soft and it is like a sponge. So this outer part of the bone or the outer layer of the bone is called as cortical bone, and the inner part of the bone is known as the spongy bone. So every 5 to 10 years these bone cells break and new cells. So this process is known as bone remodeling. So in this bone remodeling, for the spongy bone, every 5 years this bone remodeling happens. So in that one type of cell that is known as osteoclast, this osteoclast will break the older cells, and another such kind of cells that is known as osteoblast will build new kinds of cells. And even same for cortical bone, but for cortical bone the time duration is after 10 years. So after 10 years this bone remodeling happens. So in that time also the osteoclast will break the older bones, and this osteoblast will build the new bones. But what happens if a person is suffering from osteoporosis is that in that time the osteoclast cells, what are the cells that is breaking the older bones, that is the osteoclast. So this osteoclast number will increase and the osteoblast number will decrease. So that's it, there will be some disbalance, and this is why the person is getting osteoporosis. So what are basically the symptoms for this osteoporosis? Basically the person will not get any symptoms. The person will only get to know that the person is suffering from osteoporosis if they get any fracture. So this is the one kind of symptom. So how can you diagnose whether a person have osteoporosis or not? So to diagnose it, we need to go to doctor. Then the doctor will do this bone scan. So this doctor will do bone scan. So in this scan is known as dexa scan. So in this dexa scan, the doctor will tell whether the bone density is normal or it is weaker or it is very weaker. So if you do this DEXA scan, then in that if the reading is saying below -1, so that means that you are normal. And if the reading is showing between -1 and -2.5, that means that the person is suffering from osteopenia. So this osteopenia means that your bone is weak. But if the person is suffering from osteoporosis, then the reading will show that it is above -2.5. That means that the person is suffering from osteoporosis. So this is the diagnosis for this osteoporosis. So how can you treat this osteoporosis? So basically, doctor will give two kinds of medication. First type of medication or drug is known as zoledronic acid. What does this zoledronic acid will do? So this zoledronic acid will bind with the bone mineral. Okay, so at the surface of the bone there is some minerals that is known as bone minerals. So this zoledronic acid will bind with the bone minerals so that the absorption of these bone cells will become less. So that's why the osteoclast will decrease. And second kind of drug is called as teriparatide. So what does this teriparatide do? So this teriparatide will increase the formation of this osteoblast, and you know that this osteoblast is forming new cells of the bones. So this teriparatide will increase the osteoblast. Okay, so these are some of the medications mostly doctor will give for treating against this osteoporosis. But the most important, the person should eat good kinds of foods which are containing high in calcium and vitamin D. And also if you need, then doctor can also give calcium and vitamin D supplements. Okay, so whatever this medication I'm telling, this is just for knowledge purpose and not any medication purpose. So this was all about this osteoporosis in this topic. So I hope you like this video. You can share and subscribe. You can comment also in the comment box. So thank you. Bye.